I'm Aundrea Cline-Thomas with ISPOR TV. I'm here with Indranil Bagchi to discuss HEOR and access as the healthcare landscape becomes even more complex. We're so happy to have you here.
Pleased to be here.
Yeah. So how do the HEOR and access functions need to evolve to create a holistic value demonstration strategy?
So let me start by saying, first of all, thank you for having me here. The development, demonstration, and communication of value evidence of our medicines have never been more important, or the need has never been stronger. Historically, the industry used to focus on regulatory stakeholders to ensure our medicines get the regulatory approval, and then physicians to ensure clinical uptake. But over the last 10, 15, 20 years, the need to demonstrate value to payers, health technology assessment agencies, insurance companies have been growing increasingly. And as such, it's the role of the HEOR functions and the market access functions working together to make sure the medicines we develop don't just ensure they deliver efficacy, safety, and quality, but also demonstrate the right value and affordability.
So what would you say created that urgency over the last 10 years?
The reason that urgency came about is gone are the days when we can send out large sales forces and expect share of voice to be everything. In the end, as good as your medicine is and as well as you demonstrate the value proposition to a physician, unless your medicine is on the formulary, which is more and more restrictive these days, that medicine will never reach the patient. In addition, when we talk about listing of medicines, historically it was based only on the pricing of the medicine and the population it could cover. But increasingly, health technology assessment agencies need evidence and data, which in some cases is even more stringent than what regulatory authorities need. And as such, the importance of developing data that meets not just the needs of regulators, but also physicians and payers and HTAs around the world.
How does the community need to be thinking about it differently when it comes to those data points? Are there measurements that they really need to consider getting so they can really make that business case stronger?
Absolutely. Regulators look at benefit risk. So as long as the benefit of a medicine outweighs the risk, you're likely to get regulatory approval. Payers look for value. They look for comparative effectiveness. So to make a payer or HTA submission, just the benefit risk data will not do it. You need to show comparative efficacy compared to the next best comparator or the gold standard in the market. Which is why in many cases we see the medicines get regulatory approval, but then there's long drawn access conversations because in many cases, industry has not generated the right data that meets the needs of payer stakeholders, or they have generated data that's okay for certain countries, but not the needs of the specific country that we're talking about.
Let's look at it from a continuum, How can the conversations be had earlier in the process so they're generating that information for the different audiences that they needed earlier in the process?
That's a great question, and I'm glad you raised it because, again, historically, this consideration for what a payer or HTA would need and how we would price the medicine would only start after the phase 3 trials have started. Because after that, a profile is generated, and the question is, where can we price this medicine to make sure we get reward for innovation, and which population will this medicine be written for? But the way things have changed over the last 10, 15, 20 years is because of the need to generate data that meets the needs of payer stakeholders, these conversations need to start much, much earlier, definitely before phase 3. For example, with this new EU health technology assessment process coming through, there will be a process called JSC, Joint Scientific Consultation, where industry will have an option to engage in joint consultation with the regulators and the EU HTA authorities to make sure the clinical trial program that we put in place and the endpoints we have and the PICO, population, intervention, comparator outcomes, meets the needs of regulators as well as stakeholders. So I would say conversation needs to start much earlier, way before phase 3.
Do you think this urgency ends up being better for the patient in the end?
Absolutely, yes. Because in the end, you can get a regulatory approval and physicians may be hungry for the newest technology, but in the end, If the payer or HT agency has not signed up and the medicine is not available, then the patient doesn't get benefit from that medicine. So our goal is to identify a problem and treat it from the bench to bedside. That last mile to the bedside is where, access and HEOR efforts need to be really, really strong.
And that last mile seems like the longest.
That last mile seems to be the longest, and that's where a lot of patients keep on waiting for the medicines, and it becomes a long-run conversation, which in the end is completely unacceptable because the reason we exist is to provide benefit to our patients.
Who within organizations are tasked with kind of change? Because this is a mindset shift. It's a actual shift, but it's also a mindset shift first. Who within organizations is responsible for kind of shifting focus in this way?
It's the most senior leadership. It's the C-suite. And essentially, that's where market access and HEOR needs to think and act differently, not just be the methodologists, not just develop good technical data, but also be able to communicate that resonates with external stakeholders, but also resonates internally. The C-suite needs to understand the importance of investing in these functions, making sure they have the right budget, they generate the right data, because in the end, this is the function that will remove those barriers and enable access to medicines for all patients that need them.
Thank you for helping us close the gap on that last crucial mile.
Thank you so much for having me.
I'm Aundrea Cline-Thomas with ISPOR TV.